CNA Practice Test 2025 Updated Certified Nursing Assistant Exam Questions and Answers. Question 1. What is the most effective way to prevent the spread of infection? Wearing gloves, using hand sanitizer, hand washing, staying at home. Hand washing is the single most important practice. Question 2. What is the normal range for an adult's respiratory rate? 8 to 12 breaths/min, 12 to 20 breaths/min, 20 to 30 breaths/min, 10 to 15 breaths/min. Typical adult respiratory rate is 12 to 20 breaths per minute. Question 3. A resident is having difficulty breathing. What position should you place them in? Prone, supine, Fowler's, lateral. Fowler's position helps expand the lungs. Question 4. When assisting a resident with a weak side to dress, you should dress the strong side first, dress the weak side first, dress whichever side is closer, let them do it alone. Dress the weak side first to simplify the movement. Question 5. What does NPO mean? New patient only, nothing by mouth. Nurse practitioner on call. Next physician order. NPO stands for nothing by mouth. Question 6. Which of these is a sign of dehydration? Increased urine output, dark, concentrated urine, moist skin, slow pulse. Dark urine and low output indicate dehydration. Question 7. What is the first step when you find a resident on the floor? Call the nurse. Pick them up immediately. Ask what happened. Go get a wheelchair. Stay with the resident and call the nurse for assessment. Question 8. How often should a resident's position be changed to prevent pressure ulcers? Every hour, every 2 hours, once per shift, when they ask. Repositioning every 2 hours is standard. Question 9. What is the standard unit for measuring fluid intake? Ounces, milliliters, ml, cups, pints. Fluid intake is recorded in ml or cc. Question 10. Which of the following is considered a subjective observation? The resident has a temperature of 101 F. The resident says they have a headache. The resident's skin is red. The resident ate 50% of their meal. Subjective observations are reported by the patient. Question 11. What is the correct temperature for a bed bath? 90 F, 105-115 F, 120-130 F, whatever the resident wants. Warm water, 105-115 F, is safe and comfortable. Question 12. What does HIPAA protect? Healthcare worker safety, patient privacy, hospital funding, insurance rates. HIPAA protects patient confidentiality. Question 13. A resident is choking and cannot speak or breathe. You should perform the Heimlich maneuver, give them water, pat them on the back, ask them to sit down. Abdominal thrusts are used for severe airway obstruction. Question 14. When performing perineal care, you should always wipe back to front, front to back, side to side, circular motion. Wiping front to back prevents UTI. Question 15. What is the term for a permanent shortening of a muscle? Atrophy, contracture, fracture, sprain. Contracture is the permanent shortening of muscle. Question 16. Which vital sign should be reported immediately? Pulse 72, BP 120/80, temp 98.6, respiration 8. Low respiration 8 is a medical emergency. Question 17. What is the purpose of a gait belt? To keep the resident's pants up. To assist with safe transfer. To restrain the resident. To measure the waist. Gait belts help with safe moving and walking. Question 18. A resident with Alzheimer's is confused and searching for their mother. You should tell them their mother is dead. Redirect and use validation therapy. Ignore them. Laugh at them. Redirection and validation are best for dementia patients. Question 19. How should you communicate with a resident who is hard of hearing? Shout loudly. Speak clearly and face them. Write everything down. Speak into their ear. Facing them helps with clarity and lip reading. Question 20. The first sign of a pressure ulcer is usually an open wound, a blister, reddened skin that doesn't blanch, a purple bruise. Non-blanchable redness is a stage 1 ulcer.